I think I should start now. That's okay.
No, let me just do an introduction really quick, and then I'll let you come in. Welcome, everybody. I'm going to give it just a few more seconds to let people in. I'll do an introduction, and then Miriam, you can present as soon as I introduce you. Okay, so welcome to day 2 of our Global Health Landscape Symposium. My name's Eliana Monteforte, and I'm the Director for International Advocacy and Engagement at Global Health Council. I'm really proud to be here to moderate this panel made up of speakers from this year's Advocacy in Motion Grants Program. We also call it AIM. So we started this AIM grants program in 2022 to support civil society organizations' advocacy, especially toward health equity, and also to amplify the voices of local and regional organizations. And the theme for this year's AIM grants was pandemic preparedness, prevention, and response. So since the COVID-19 pandemic, there have been various global, regional, and country level initiatives focused on strengthening health systems to ensure pandemic prevention, preparedness, and response, or PPPR. The World Health Organization established an intergovernmental negotiating body to draft and negotiate a treaty or agreement under the Constitution of WHO for PPPR. The World Bank is hosting the Pandemic Fund, which finances critical investments to strengthen PPPR. And we saw last year in the 78th United Nations General Assembly the high-level meeting on PPPR, where member states adopted a political declaration. So while all these agreements and declarations are important, we all know that change happens on the ground. So in the regions and countries and where we see political commitments turn into action. Through the 2024 AIM program, GHC supported 5 civil society organizations with their PPPR advocacy initiatives in Colombia, Peru, Pakistan, Iraq, and Botswana. And so in a moment, I would like to turn to our speakers from this grants program to share a bit about their organizations, the PPPR challenges that they see in their regions and countries, the purpose and objectives of their grants and some of the outcomes that they've seen so far, and then also how they intend to move forward and support PPPR in their countries. But before I introduce our first speaker, I would like to go over some logistics. So this meeting is being recorded and it will be posted on the event platform shortly after the session ends. You are welcome to ask questions in the chat box at any time during the presentation, and there will be a question and answer session at the end of the panel. So after all the speakers are done with their presentations. When we get to the Q&A, you're also welcome to raise your hand if you want to ask a question live directly to the speakers, and I'll call on you as I see hands go up. So that's it for logistics. Without further ado, I would like to present our speaker, Miriam Sigatula, who is a consultant with Taskeen Health Initiative, focusing on advocacy and research programs. She's also an MPH candidate in global health at the University of Washington, Seattle, where she serves as a research assistant in the Department of Global Health, focusing on global mental health policy. So Miriam, I'm handing it over to you, and please just let C-Ray know when you need her to click to the next slide.
Thank you so much, Eliana, for the introduction. Hello, everyone. I'm really excited to present the Skeen's work in the past year with the help of Global Health Council. So we work towards establishing and managing an emergency and crisis working group. Next slide, please. Thanks. So a little about the Skeen Health Initiative. We're based in Pakistan, out of Karachi. Our mission is to promote mental health and prevent mental illness in Pakistan. And we do so by increasing mental health awareness, providing accessible, free of cost telemental health services, and advocating for mental health policy change in Pakistan. In Urdu, Taskeen means to comfort, and that really aligns with our vision. Next slide, please. The health problem that we were looking at came from the 2022 floods that Pakistan was affected by. UNICEF estimated that 1/3 of the country was submerged underwater, with 33 million people affected and almost 8 million people displaced. Through initial needs assessment, it was revealed that within the flood-affected population, there were people exhibiting symptoms of PTSD, depression, and other mental illnesses. So we identified the problem as the fact that even though there were comprehensive rehabilitation and rehabilitation efforts, there was no attention towards MHPSS, which is mental health and psychosocial needs within this population. So there was a need for integration of a multi-sectoral and community-based mental health and psychosocial support into emergency response systems to provide holistic recovery and rehabilitation to build long-term resilience in the communities affected. Next slide, please. Yeah, so our first objective was to convene an emergency and crises subcommittee or a working group under the Pakistan Mental Health Coalition. So Pakistan Mental Health Coalition is managed and organized by the Skin Health Initiative. It is a national network of mental health organizations and other organizations wanting to work in the mental health sector in Pakistan. So under the PMHC, we convened a group titled Emergency and Crisis Subcommittee. Within that group, we recruited civil society organizations that had some expertise in developing or integrating MHPSS response in emergencies. And every month, we held 1 or 2 subcommittee meetings to research into the best practices within the Asian region, into existing national PPR protocols and guidelines to integrate MHPSS during national emergencies. Next slide, please. Yeah. So during these subcommittee meetings, when we were conducting our research, we decided to conduct a systematic review focusing on 2 things. First thing was to see what kind of mental health problems are more prevalent in communities affected by such emergencies. And second, what kind of interventions exist that are not just mental health focused, but also multi-sectoral and more feasible for countries like Pakistan. So what we did was develop that systematic review, and from that systematic review came a protocol which had a comprehensive plan for integrating MHPSS. Next slide, please. So third objective was, once we're done with the protocol, we decided to disseminate it through a stakeholder event. The main purpose of the stakeholder event was just to identify our key organizations and key agencies to advocate for the MHPSS protocol, as well as try to talk about how important this issue is, and also, of course, to disseminate the protocol. Next slide, please. Ultimate outcome was once again to reduce mental health problems in populations affected by national or provincial emergencies, and to increase awareness of mental health in communities with reduction in marginalization and stigma. Our intermediate or short-term outcome, apart from the protocol document that we developed, was to improve coordination among civil society organizations and government rehabilitation authorities to address MHPSS needs in the target population. Apart from that, the short-term outcome was also to provide immediate access to psychosocial support for such populations. Next slide, please. Thank you. So our next steps, and part 1 of that, I'm happy to report because of the advocacy team that's present in the participants today, is that we're hoping to collaborate with the Provincial Disaster Management Authority of Sindh, the province where our head office is located, to integrate the MHPSS protocol within their existing frameworks for rehabilitation and recovery for populations affected by emergencies such as floods. I'm happy to report that we have successfully forged a partnership with them, and we're well on our way to integrate our protocol within their systems. And the second objective, which is like a larger objective, is to scale our MHPSS protocol to kind of implement it in other provincial disaster management authorities in Pakistan, and to make it more contextual for those provinces as well. And with that, my presentation ends. Thank you so much. I will take questions end of this presentation. Thank you.
Thank you, Miriam. This is great. And I love that this organization focused on mental health. I'm sure many of you have read that as the results of COVID, were devastating for so many people. Mental health, I think, became a really important topic. But it's not just, this doesn't just happen with pandemics. It happens with a lot of different climate disasters that we've been seeing across the board. And so, mental health is important. And I think that with all of the conflicts that we've been seeing around the world, we're really starting to understand how important it is to address mental health. So I am definitely going to get back to you with questions once we're done with the panel, but I'd like to now present our next speaker, who is Roberto Lopez. He's the Director of International Health Action in Peru. He's a sociologist and advocate for universal access to medicines, vaccines, and other health technologies. Roberto also advocates for R&D and the production of new health technologies in the Latin American region. So Roberto, I will hand it over to you.
Uh, uh, Good morning, good afternoon to everybody. Thank you for the introduction. Next slide, please. Yeah. Acción Internacional para la Salud, that could be in English, Health Action International, is based in Peru. And our organization advocates for universal access to health technologies and the democratic participation of communities in the formulation, implementation, and surveillance of health policy, particularly those related to medicines and vaccine. The next, please. The problem is that we can see everywhere is the restricted access to medicines of people in middle and low-income countries. And this was very clear during the COVID-19 pandemic that raised awareness on the dramatic condition millions of people live in the world, lack of access to health technologies. In front of this, the WHO opened a process to negotiate among all member states a treaty or agreement to prevent, prepare, and respond to future pandemics. This negotiation process would have been finished in May 2024, but there were disagreements on key issues, especially the participation of developing countries in the benefits of new technology developed on the basis of sharing information from, particularly from the developing countries. Another relevant issue is the suspension of intellectual property right, like patents, for example, in case of pandemics, as it was proposed during COVID-19 by a majority of countries of the World Trade Organization. This didn't happen. Next slide, please. So one of the objectives was that the governmental administration, in the case of Peru, reports transparently the Peruvian position and critical issues being negotiated for the pandemic treaty, because the government, are used to not to be transparent about this kind of negotiation. So we send letters to the Peruvian president warning an official and critical issues of the treaty negotiation. We created an ad hoc section in our website with relevant information on the negotiation process, so everybody could get there to get the needed information about the process. Next slide, please. The other objective was to educate congressmen and try them to be aware about the process and receive relevant information to follow up to the treaty negotiation. We had several meetings with some of them, and a very important meeting with the Health Commission of the Parliament. The other objective is referred to the Latin American Civil Society Organization. who urged governments to articulate efforts to have an agreement based on equity, solidarity, and cooperation. So we had several webinars about the issue, press conference in Lima, Peru with AHF, and other letters to governments in Latin America, and also a talk shop in Mar del Plata, Argentina. Next slide, please. The outcomes we see as relevant the pronunciation of the declaration of the Minister of Foreign Affairs that never did something like this. No, the Minister of Foreign Affairs declared that the treaty lacks ambition, and also she during the WH Assembly in 2024 said that we have to strengthen the international cooperation in order to have a mechanism that assures timely access to health tools, technology transference, and the interchange of pathogens. The health ministry also sent a letter to civil society organizations expressing agreements on critical issues being negotiated. Also, the Peruvian government organized a meeting with the civil society organization to report on the advances of the negotiation for the pandemic treaty. These kind of meetings never happened before. The next slide, please. So, next steps. There are very heavy tensions among rich and poor countries in the negotiation process, and taking into consideration the fragmented performance of countries of the South, especially from Latin America, it is necessary to continue advocating with clear position to achieve a binding agreement with guarantees an effective response to next health emergency. We have to promote the articulation of countries of the South, Latin America included, in order to scale up the research and development and production of health technology, which is going on in this period. Civil society organizations must advocate for improving the national health system with adequate investment and international cooperation. This is one task that every country should do. Next, please. Thank you very much.
Thank you, Roberto. I think that this is such a good example of the type of advocacy that civil society organizations can do in the countries that can affect these global health initiatives. I think a lot of the time there's a disconnect between what's happening at the global level and what happens at the country level. And this is just such a great example of how you can really bring the two together, and how the advocacy that you do on the ground with your governments can really influence what your governments take to the global level in their negotiations. And certainly when we get to the Q&A, I'd love for you to talk some more about the relationship that you built with the government and how you kind of fostered that relationship to get to where you are with the civil society engagement piece. But I'm now going to move on to our next speaker, who is Dr. Masar Al-Kurabi. He is the founder and logistics officer at the No Borders Humanity Organization and served as the coordination officer. With expertise in project management and medicine, Dr. Al-Kurabi has played a key role in coordinating humanitarian logistics and health initiatives that serve vulnerable populations across Iraq. His commitment to empowering local communities through accessible healthcare and sustainable development has made a lasting impact in the region. So I'm very excited to hand it over to Dr. Masar. Dr. Masar, are you there?
He's mute.
I'm here.
Yep,
I'm
you're
sorry,
on
I'm
mute.
sorry.
There you go.
All right. Thank you a
Thank
lot,
you.
Elena, for the nice introduction.
No problem.
And hi there, and good morning. In this slide, I will briefly discuss our role in the advocating for pandemic prevention, our response in vulnerable communities, and focusing specifically on our recent effort in Nasiriyah city. Please, next slide. Here you can see a brief introduction about our organization and establish and the area of working and so on. Please, next slide. All right, the health problem. In the Nasiriyah city, there is a pressing need to increase awareness about diseases and healthcare practices. The community, yes, faces challenge due to a lack knowledge regarding preventive measures and effective healthcare practices. Please, next slide. Grant objectives. To raise community awareness about disease prevention, to promote a dialogue among stakeholders to improve public health, and finally, to make strength team and community capacities. Please, next slide. Activities conducted. Training and onboarding the project, organize dialogue sessions and health awareness campaigns, as well as to make disseminated educational content via a social media platform. And you can see here brochures and photo from our workshop. And all this is real and we make by own self. Please, next slide. Expected outcome, improved healthcare awareness within the community, enhance community dialogue to tackle health challenge effectively, and comprehensive evaluation report providing actionable insight for future initiatives. Please, next slide. Even next slide also. Outcome and next steps. We at NBH organization, we are so proud of what we have accomplished so far. However, we recognize that much more can be done to enhance the health and well-being of vulnerable communities. And that's it, thank you. Please, next slide. And that's it, thank you very much. And I am ready to answer any question. Thank you.
Thank you, Dr. Massar. I really also wanted to just point out how this grant program that you all did is a really great example of the kind of relationship that civil society organizations have with the communities, and how critical it is for civil society organizations to be involved in educating the communities and building awareness, because there is a lot of trust between civil society organizations and the communities, which sometimes doesn't exist at the government level. And so later on in the question and answer, I'll come back to you to talk a little bit more about how you develop that relationship and how your organization continues to work with communities.
All right.
Thank you, Dr. Massar. So now we're going to get to our next speaker. So our final speaker is Kennedy Mupeli, who is a passionate advocate, activist, and educator within the HIV community. He was an AVAC Advocacy Fellow in 2017, where he advanced key HIV prevention initiatives. As a dedicated community HIV/TB basic science educator and treatment advocate, Kennedy focuses on empowering individuals with knowledge and access to care. So Kennedy, I am going to now hand it over to you to talk about what Seyoho did for the grants program.
Thank you so much, Eliana. So good afternoon, good evening, no others is good morning. Everyone, my name is Kennedy Mupeli from Botswana, and I'm representing the Center for Youth of Hope, or Seyoho in short. Today, I'm excited to present our work in empowering young people to lead pandemic preparedness efforts in Botswana through advocacy and education. This was made possible by the Global Health Council grant. This initiative aligns with our mission to drive youth engagement in health promotion and policy, especially in light of the pandemic impact on our communities. Next slide. So Center for Youth of Hope, OCF, was founded in 2002 as a non-profit organization in Botswana, initially focusing on HIV treatment, prevention, and advocacy. Over time, our work has evolved to cover a broad spectrum of health issues, including wellness, non-communicable diseases, and the impact of climate change on health. Our recent focus is on pandemic preparedness and response, where we aim to equip youth with the tools and knowledge to become advocates and influence policy for a more prepared health system. Next slide. So this is our center where we operate from, just outside our capital city, Gaborone. Next slide. So, like many countries, Botswana faced, a significant challenge during the COVID-19 pandemic. So the health system struggled with service disruptions, mental health issues, and also there was a surge in gender-based violence. However, despite these challenges, youth participation in pandemic response strategies was limited. This gap highlighted the need for greater inclusion of young people in health decision-making processes, which is precisely what the project seeks to address. Next slide. So our AIM grant enabled us to really focus on three primary objectives. The first one was to equip young people with advocacy skills to influence PPPR policies. The second one was just to develop educational tools, such as the pandemic info notebook that we produced that aid in learning and advocacy. And the third was to engage with policymakers pushing for a formal adoption of a PPR policy in Botswana. Next slide. So this is, we did some role plays. These are young people trying to rehearse on how to engage policymakers. Next slide. So expected outcomes. So we had 4 key outcomes from this initiative. The first one was educational outreach. So through workshops that we conducted across the country, we engaged over 300 young people directly on pandemic preparedness education. The other one was capacity building. We trained youth advocates to lead PPPR efforts, which allowed them to collaborate on spreading PPR strategies within their communities. Then the third one was policy advocacy. Our team initiated meaningful dialogues with policymakers, establishing a foundation for a PPR policy. And the fourth one was resource development. So we created the pandemic education network that were essential in helping participants retain knowledge and served as a practical resource. Next slide. So our work is far from over. We are focusing on several next steps to solidify our progress. So we are looking at strengthening, policy engagement. We will continue our advocacy efforts to organize follow-up meetings with policymakers to speed up policy adoption. And refinement of educational materials. We're also looking at the feedback from participants, plan to improve our pandemic notebook or IEC in future workshops. Also establishment of a Botswana PPR CSO platform. In this platform, we aim to create a forum for civil society organizations to adopt and advocate for a comprehensive PPR strategy, and also a robust monitoring and evaluation framework that will help us assess long-term impact of our workshops. and advocacy efforts. Next slide. So in closing, I just want to thank everyone involved in this project and the Global Health Council for their support. This initiative is a vital step in creating a resilient youth-led pandemic preparedness framework in Botswana. Together, we are fostering a generation of empowered young advocates ready to lead the charge in health resilience and policy reform. Thank you so much.
Thank you, Kennedy. Really important to involve youth in pandemic preparedness and response. And I think this is a really good example of how you can do that at the country level. Really impressive how many youth you were able to train in a one-year time period. And since I had you wait so long to do your presentation, I'm going to go to you first with a quick question. Could you expand a little bit on how you see these trained youth being institutionalized in a pandemic prevention, preparedness, and response program or strategy at the country level? So you all did a lot of work with youth, a lot of work training them and educating them. The next step I would think would be to really bring this program to the government and seeing how you can kind of institutionalize and make sure that you're using these youth in a time when there's a pandemic or any kind of emergency. How do you kind of envision that happening? Or is it already happening?
To a large extent, I think it's already happening. So what we are doing currently, we working with civil society organizations where these young people are affiliated, because these issues should start from the established organizations and push the agenda upwards to parliament. So what we're planning to do now is to use a backbencher to put up a motion in parliament so that this can be enacted as some kind of legislative action through parliament.
And are these youth that you have worked with in the past already as or are they people that are part of your organization, or how have you identified these youth?
So these are some of the youth who work them. I think the majority we've worked with them before, though when we're doing these workshops, other youth joined in. So we're excited to have a larger number of youth that we've worked with before. So we were actually building on the advocacy work that they've already been exposed to. And those that were new, we had to start also to engage them to begin to appreciate this work of advocacy and community engagement.
That's great. Okay, I do want to pause here and just say I'm going to ask the presenters a few questions, but if any of you start thinking of questions, please feel free to put them in the chat. And once I get through a few questions that I'd like our speakers to expand on, I'm happy to get to some of the questions in the chat. And also please feel free at this point to raise your hand if you would like to ask a question directly to one of the speakers. So I'm going to go to Dr. Massar. Dr. Massar, I was really interested in learning about how your organization has really fostered a positive and trusting relationship with your community, and how you feel you can leverage that to help, build awareness around health, to help achieve governments achieve a lot of their health initiatives in the region or in the country. If you can just talk a little bit about the origin of this relationship you've had with the community and how you've developed it over time.
All right, thank you a lot. And this is a nice question. At the beginning, we live in the southern of Iraq, a lot of the rural area, and everything started from a COVID pandemic. And we think and decided that all our people lack a knowledge about prevention of diseases and so on. And because we face a lot of cases and a lot of people die because of the COVID-19 and so on. After that, when we engage in the Global Health Council and we apply for the grant and so on, after that, we start our activity plan to sharing awareness and awareness about disease, about hygiene, about even about vaccine. It's very important. And after that, we started to just make brochures and posters and preparing for the awareness campaign and so on. Even we did how we can call a workshop for that, and we teach people from the beginning, even to improve their life by the health uh, information. And we also like learn and training our people to how we decided and dealing with a lot of situation and that which related to the health by the put questions and put the strategy to start from the home to the outside of the home. And it was very amazing. Our people so happy for information. And we also reach for the hospital and a blood center, and we published our brochures and poster. Our people so happy with this one because and a lot of authorities from a government cannot reach for this kind of the people, and for that we reach for them, and they even if they face anything, now we start to open some brochures and they start to call the hospital and a polyclinic in case if they have any issues, and that's amazing. And they thank so much Global Health Council and for this support. And we are so appreciate your hard working with us. Thank you.
Thank you, Masar. That's such a great example of how these civil society organizations can really get to those communities that perhaps government or people at the central level can't necessarily get to, those hard to reach populations that are often left behind. And also super interesting to hear that you also went to hospitals and health clinics to do your awareness campaign. Another great, partner that you brought into the work to make sure that you can continue to reach the majority of the community that you were targeting. Are you planning on expanding this awareness campaign to other areas?
Absolutely. Absolutely. And for that, we about 2 days ago, we have meeting to improve our skills, our tools, and we had meeting with the Dell company to, as you know, in the future, of course, we will transfer to a digital world, and we use this tool to expand our awareness for a lot of people in our society. I mean here. Any city except Nasiriyah. Of course, Nasiriyah, and we continue here to make the assessment and look what will be after all our work with the people. And this is very important. And that's it.
And just one last question. This is just very interesting. Do you have somebody at the government level that you're liaising with or working with to kind of share some of the work and the outcomes of your work to get some of that government support, or not quite yet?
It's not look like support. It just helping us by permission and support our workshop by the media and the social media, plus our own work, because as you know, we are at the civics society and we work alone, and we encourage our people to support themselves by themselves in the social media and called the influencer. And we did a great job in the social media like Facebook, TikTok, Instagram, and so on, plus our website. And that's our tool for nowadays, as you know.
Yeah. Well, thank
Mhm.
you, Dr. Masar. That's really great work.
You are welcome.
I'm going to go over to Roberto. So Roberto, I work with a lot of civil society organizations, and many of them report that the greatest challenge that they face is encouraging governments to engage with civil society, and like really showing governments why it's so important to engage with civil society. I mean, GHC is constantly advocating for more civil society and non-state actor engagement, even within WHO, and other multilateral agencies. So I know that this is a challenge that a lot of people face. And I think the relationship that you all have with the government of Peru was really interesting. I'm curious to hear more about how you developed that relationship with them, and how you were able to achieve this kind of engagement with your government.
Thank you very much, Eliana, for the question. You are right. It is very hard to get involved, the government and also civil society organization in one project. It's
Yeah.
very difficult. No, we know
Yeah.
that, we understand. But so we have to advocate very hard, using some of the means we have at hand. For example, the media. The media is very important. It is very important to articulate efforts with the media so they can say in a better way, maybe, so they can launch the message, in the best form they know. So the government in some moment are so pressed, so that they have to respond to the question that civil society organization have.
Mhm.
And that happened in this project. Because we started very early during the process of negotiation of the treaty, and so we knew what was going on, and the government didn't have idea about what was going on. So we have in advance an advantage, and so we try to educate the government about the critical issues that they were negotiating, and the name of the country, and the name of other countries, and the name of all the countries of the world. No, so it is important also not only to have the media, to articulate with the media, but also to have a very complete knowledge of the process and the issues involved in the process. So you can be presented as a qualified actor or player, in this process. I think that these two things are very important to get involved with the government, in a common objective.
Yeah, really, really well stated. And I know that you were also talking about working with other civil society organizations in the region of Latin America. Can you talk a little bit about that and, what the outcome of that could possibly be, how it could impact negotiations?
Yeah, that's very important also. No, we realized that alone we cannot do much. So in the country, no, we articulate. We have a kind of alliance with other civil society organization to push together the government. And also in the Latin America scenario, we also had in this project, the articulation with other organizations of Latin America, and that thought in the same line. We had the same opinion about the process, no? So we organized with them several events, to discuss about this process of the pandemic treaty, and that's very important. And it is also important to coordinate at the level of the region, because the fragmented participation of the country in this negotiation process.
Absolutely.
It is important to educate, to inform, lobby the government, to act together in this process. If not, they are not
Wonderful.
going to get anything.
I completely agree with that, and really wonderful that you all are working so diligently on this task, although I know daunting, but yes, incredibly important to bring the region together to have a more powerful voice at the negotiating table. Thank you so much, Roberto. I'm going to move on to Miriam, and I know we only have about 5 minutes left because I know we have to finish at 8:50 so people can get to their next session. So I don't see any questions in the chat so far. So Miriam, I did just have something that I wanted you to expand a bit on. I would love to hear from you about how you developed the content of the protocol. You did mention that you had a few workshops getting, information from civil society. Would love for you to expand a little bit on that, and then maybe hearing to how you all envision kind of mainstreaming this within like a government protocol?
Yeah, thank you so much, Eliana. That's a great question. Well, it started with brainstorming within the subcommittee on how we want to approach this. And obviously, we needed reference of different or other organizations internationally who have implemented similar work. So we looked at Oxfam and other INGOs that had developed such a protocol. The purpose of the systematic review itself was to define what kind of interventions exist and what are feasible for Pakistan. So the second part of it was coming mainly from the subcommittee. Within the subcommittee, we had research scientists from different organizations. We had community-based organizations that were implementing MHPSS within Pakistan. So kind of consolidating all of that together to come up with not just a strategy on how to implement it, but what to implement it. And we also did like several stakeholder mapping as well, just to see what kind of organizations exist within Pakistan and then specifically in Sindh that have the capacity, then that can also build their capacity to integrate or implement MHPSS within these communities. Can you repeat the second part of your question, please?
So just hearing a little bit about, you have this protocol and you're kind of piloting it. How do you envision expanding it or working with government to kind of institutionalize it as, part of a government strategy?
Okay, got you. So right now we're working with PDMA Sindh, that's a provincial disaster management authority. So they have their own rehabilitative framework just to see how to rebuild communities after, it's been impacted by any sort of emergency. So within that framework, we're going to integrate the MHPSS aspect of it. So when there is an emergency and they're coordinating, they know where to look for organizations that are already working within MHPSS and implement it. When it comes to scaling it to other provincial authorities, we envision it in a way that we've established a partnership with PDMA Sindh. And since all these authorities are kind of connected to one another, they're part of the National Disaster Management Authority. So we hope to kind of engage other provinces through them. First, to kind of establish that this kind of protocol works and it exists within Sindh, and to see whether other provinces can follow the lead once they've seen that this is quite impactful.
That's really wonderful. And I'm sure there's going to be a lot of kind of back and forth, getting people's feedback and kind of revising it based on, what you see in the pilot programming, maybe even getting feedback from government. But this is such a great initiative considering, the mental health impacts that so much conflict and, climate change disasters have. Really grateful for your organization to be tackling this issue and being such a great example. Hopefully other people will follow suit. So thank you very much to our speakers. I'm just going to pause and see if there are any questions quickly from the audience. I don't see any in the chat. Okay. Well, we are now at the hour. I just wanted to say thank you to our speakers and our grantees for this year. Clearly, they've done some absolutely amazing work. I have put a link in the chat that has information about all of the grantee organizations if anybody here wants to learn more about them. or would like to get in touch with them, please let me know, and I'm happy to connect you. I'm just really impressed with the great work that all these grantees have done, and this is just over 1 year. So very impressive, and I really hope to see this work continue. So please, let's keep in touch and see how GHC can continue to promote and talk about your work. I just want to say that GHC truly believes that it's critical that civil society organizations at the local and regional level are advocating to governments and are working with governments to make these political commitments that are happening at the global level actually happen on the ground. We know how easy it is to make a commitment. It's so much harder to actually translate that into action. And we at GHC truly believe in this very powerful role that civil society organizations play in making that happen. So these presentations are just a glimpse of what civil society can offer in support of global health initiatives. And GHC will continue to push governments and multilateral agencies and other donors to engage and support civil society organizations. So with that, I just want to thank the audience for attending and listening. And I really do hope that you all can stick around to enjoy the rest of the symposium. Thank you, everybody. Bye.